So why do people that have experienced the trauma use substances to cope? Because they work. Hey, I'm Dr. McCleary, and I make mental health videos for veterans. So before you guys report me to the APA for advocating for drug use, this video is not about that. It's not a video to advocate for drug use. It's also not a video to advocate for using substances to deal with PTSD. What this video is about is figuring out why substance use and PTSD are such close friends. If you've ever seen one of my videos about PTSD, you know that I talk about avoidance a lot. Avoidance is a core symptom of PTSD. The last thing that anybody that has experienced a trauma wants to do is to experience something similar to that experience. So what we often do when we've experienced a trauma is we stay away from anything that smells like, tastes like, looks like, sounds like, feels like the trauma. Over the years working in the field of trauma, I've seen a ton of ways in which people try to avoid re-experiencing their trauma. But one of the most common ways is substance use. Using substances to escape. Using substances to avoid thinking about or feeling some of those terrible emotions. What I found is one of the hardest parts of using substances as a way of avoiding re-experiencing some of those thoughts and emotions associated with your trauma is honestly how much they work. I'm honest with my patients and I will tell them straight off the bat, I don't have anything as good as alcohol. I don't have anything as good as heroin. I don't have anything like that to where it's immediate and you no longer, for a moment in time, have to think about your trauma. The main problem with using substances as a way of avoiding is you're just pushing away the trauma. And as soon as you stop using substances, or as soon as their effects wear off, that trauma snaps right back at you. Substances have a funny way of working and not working at the same time. They can only push away the trauma, but they can't get rid of it. They also make you kind of use and need those substances in order to cope. You can't cope without them. And as you use more and more, as you avoid more and more, the trauma and that experience never goes away. But your substance use now has become a problem. And now you have multiple problems. You may have a substance use issue, and you still have a PTSD issue. But one is kind of feeding on the other. Another issue that often comes up is some substances are easier to get than others. Let's just leave it at that. And gaining those substances or having to get drugs in not a terribly safe way often creates more traumas. So now you not only have the trauma that you started with, but now maybe you have trauma stacked on each other because of the substance use. And now you can't stop. PTSD and substance use is kind of like being in a really bad and toxic relationship. You feel like you need them. You may even feel like the substances are your friend, but your friend keeps punching you in the freaking nuts. If you have a substance use issue and you have PTSD as well, there's still hope. And you don't have to work on one or the other at a time. As I said earlier, substance use and PTSD are so close of friends that we have developed multiple treatments to treat both at the same time. There are treatment facilities that treat both at the same time because that's how prevalent this is. That's how much this can be a toxic relationship. So you're not alone. Something to think about. If this video was helpful for you, please like it, subscribe to my channel if you want to learn more about PTSD. But more important than that, if this video was helpful for you, that means that it can probably be helpful for another veteran or another family member of a veteran. So I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran trying to help another.